Good afternoon, dear viewers. It's my privilege and pleasure to welcome you to the 15th webinar of Application of Organon and Materia Medica to the Practice of Homeopathy. We at Parul University have adopted the motto that nothing can stop us. Hence, have started the e-learning mode of conducting regular online classes, exams, and series of webinars, which is only possible by the motivation of our President, Dr. Devanshu Sir, and the Director of Ayush Colleges, Dr. Komal Patel Ma'am, who are always there to support us, as well as the core team of V4 principals of the constituent colleges of Parul University. Dr. Purav Desai, the Dean and the Principal of Jawaharlal Nehru Homeopathic Medical College, Dr. Panda Sir, the Principal of Parul Institute of Homeopathy and Research, Dr. Hita Mehta Sir, Principal of Rajkot Homeopathic Medical College, and myself, Dr. Hina Rawal, Principal of Ahmedabad Homeopathic Medical College. The initiative connects the brilliant presenters of homeopathy to the young, budding homeopaths across the nation. It is my privilege to introduce one such teacher and today's speaker, Dr. R. Prakash Sinoy Sir. He is an associate professor in the Department of Organon at Dr. Padiyar Memorial Homeopathic Medical College at Kerala. He stood first in DHMS and graded BHMS at MG University, and he also holds first rank at the Kerala state. Sir has 28 years of clinical practice, and sir, it's a privilege that sir is also a CCH inspector. It is a privilege to welcome sir today for his presentation. I welcome Dr. Prakash sir for his presentation today. Please, sir.
Thank you, ma'am. My warm welcome to this session. I thank Dr. Hina Rawat, Principal, to give me such a chance to present this topic in front of you. Once again, to all my brothers and sisters in homeopathy, my pranams. Today we are going to discuss about the knowledge of Organon and Materia Medica, how we can use it in our day-to-day homeopathic practice. All of us know the homeopathy is getting far popularity nowadays, especially in this COVID section. Our system has get a chance to give its importance, especially in the field of preventive aspects of whatever it may be. We know our master, Dr. Samuel Christian Frederick Hahnemann, in his lifetime, he published altogether 6 editions, 5 editions during his lifetime and 1 as a posthumous edition. It gives clear view or clear idea regarding the principles of homeopathy and how we can use it in our daily practice. These both 2 subjects, Organon and Materia Medica, are the backstones in homeopathy. We know Hahnemann, who born on 1755, he discovered the system in 1796, that is in his age of 41 years. So at the age of 41 years, Hahnemann discovered this homeopathy, and the first edition, it was published in his 55th year, that is in 1810. This is known as the Bible of Homeopathy, undergoes several changes, and the last one was published in 1921 by Dr. William Borick. Hahnemann is the only person who explains the disease in its real way. in its real form is miasmatic theory, which he found out at the age of 73. That is in 1828, during the fourth edition. He published the theory of chronic diseases. He was well acquainted with the 14 languages. He can easily handle 14 languages. That's one of his qualities and one of his abilities. The accidental finding out of that experiment, Syncona experiment in the year 1790. And man has a habit of, while translating, he adds his own notes or his own observations, his ideas as some footnotes. There the turning point of the discovery of homeopathy was, as all of us know. And here, in this set topic, the utility of Organon and Materia Medica in homeopathy practice. First of all, we should remember that what is disease? This is our legend principal, Dr. S.N. Padiyasa, who is a lamp of light in our lives. Our institution was established in the year 1921, one of the premium Homeopathic medical colleges in India. Here, we should know what is disease and what is health. Whenever we get a patient, when a patient comes to our clinic, the first version of a homeopathic physician is to identify whether that patient is suffering from an acute disease or a chronic disease. I'm not going to the details of acute and chronic. In practically, the definition, apart from the definition, the line of approach to be decided depends upon the nature of that disease. Those diseases with more intensity. Intensity is the factor which divides between an acute one or a chronic one. The approach, the concept of totality, the selection of medicine, potency, dosage, reputation, advices, follow-up, etc., all are entirely different in these two cases, in acute and chronic diseases. So when a patient enters into our consultation room, when he begins to speak, we have to decide whether we are going to manage as an acute one or a chronic one. Here, the intensity decides the factor, and as per the intensity, if it is an acute one, what we are doing? If it is an acute one, we are considering only two factors: the exciting cause and the most troublesome symptom of the patient. There we are not giving any detailed examinations or clinical interview, case taking in depth like that. We are just considering the exciting factor and the most troublesome symptom of the patient. Suppose the patient says he is having fever, myalgia, body pain. After an exposure to some cold, damp weather, we have got a good number of medicines, and we are selecting the medicine which covers the exciting cause plus his physical symptoms. Restox, bryonia, gelsemium, etc. can become. So in selection of medicine in acute disease is rather easier. But that is not the case with the chronic diseases. In acute disease, the prescription is based upon this. Our medicine should consist of this exciting factor, and after considering that two set of symptoms, when we are selecting a medicine, it should be given as per the pathology. The dose and potency should be given as per the pathology. Generally, in acute disease, we need a medium or 200 potency like that. Definitely, it depends upon the pathology also. And the advice regarding the diet and regimen That also depends upon patient to patient, his conditions. Generally, we have to observe when we are giving the advice, we should never forget about the second aphorism. Our treatment should be gentle. We should not restrict the freedom of the patient without any apparent reason. Those things which directly aggravates the pathology of the patient should be restricted. Those things which directly antidotes the medicine we have prescribed should be restricted. These are the only two advices which you have to give to the patient. And in regarding the repetition also, that depends upon the strength of the disease. Our principle, similia similibus currentri, is not only meant for the selection of a medicine. In homeopathy, everything is dependent upon this principle. The selection of medicine, it should be similar to that of the portrait of the patient. The selection of potency, it should be similar to that of the susceptibility of the patient. The dose, it should be similar to that of the strength of the disease. So this principle, when a patient comes and says he's having severe dyspnea or severe pain, our attitude towards that patient should also be a similar one. Our facial expression, our questionnaires, it should be similar to that of the expression of the patient. In the first aphorism itself, Hahnemann says, the physician's high and only mission is to restore the sick to health, to cure, as it is termed. These two commas, they are very relevant. When a patient comes, what Hahnemann a healthy state, apparently healthy state. We know the spectrum of health. It has got 7 levels: positive health, better health, from sickness and death. So first and last, that's not our concern. We can never attain a positive health, because health means a complete state of physical, mental, and social well-being. A complete state of physical, mental, and social well-being. And not merely an absence of any disease or infirmity. So here, positive health, as all of us are human, we can't attain a complete physical state, a complete mental state, or a complete social state. So we have to try for a better health. So a patient who is in the down steps, suppose a patient comes to you with severe sickness, your mission is to raise him from that to go in above, to make him freedom from sickness or better health. So first, you have to prescribe a medicine which covers the present intensified symptoms. You make that patient apparently healthy, and then only you go for a cure. A cure always needs a constitutional medicine. In order to prescribe a constitutional medicine, the patient should be in apparently healthy state. Suppose the patient is suffering from severe dyspnea. If you are going to take his case, in order to prescribe a constitutional medicine, we will be in utter fail. So first of all, we have to give him an apparently healthy state, bring him to an apparently healthy state. Then only we have to go for a constitutional medicine. That is a similimum. There is no similimum in homeopathy. We can only use similar medicines. Why? Similimum means aptness in every aspect. The medicine should be so similar. The dose and the potency should be exactly that meets the susceptibility and the strength of the disease. That we can't attain. That's why we are not using the term similimum. We are only using similar medicine. The homeopathicity between the patient and the drug, medicine we had selected. So here, knowingly or unknowingly, all of us are using this inductive logic in our homeopathic practice. It's like the teaching of Organon is like an education, like where we are going to take the license of a vehicle. During learner's course, you are studying, you have to first you have to start the vehicle, and you have to shift the gear, first gear, second gear, third, fourth, likewise. But when you are starting practice, if you are doing like that, when you are taking the vehicle in the road without seeing these obstacles around you, if you are driving like that, what happens? Definitely there will be a clash. So the theory and practice is entirely different. You have to learn from the theory what you have to do when situation meets. So the physician is the judge of the situation. Here, in case of acute disease, we have to go for such a to find out the exciting cause and the most troublesome symptom. These three questions: what, where, how. What, where, how will give a clue regarding diseases. But that is not the case with the chronic disease. Here, in homeopathy, can a man give a clear view regarding the evaluation of disease? Chronic disease is basically categorized into three groups. All of us know: true natural chronic disease, pseudo-chronic disease, and drug diseases. So, this we have to ascertain first. When we get a chronic patient, after case taking, we should decide, we should understand the nature of that disease. Whether the said patient is suffering from a true natural chronic disease, or a pseudo-chronic disease, or a drug disease. The history will reveal. So here, suppose if the patient is suffering from a drug disease, how will know? There will be a definite history of a previous history of induce of drugs, some non-homeopathic drugs. It may be Ayurvedic, it may be allopathic, or it may be even homeopathic medicines by homeopathic physician, but they are not homeopathic to the case. So massive use of tinctures or low potency medicines or unwanted repetitions, etc. Use of these allopathic medicines, Ayurvedic medicines, etc. Finally, the patient becomes the victim of a chronic disease. This we can see in our day-to-day practice. A good number of cases are drug-induced one. And suppose a patient comes and says he's having diabetes, his blood sugar level is 290 fasting sugar. When you are inquiring, you are not getting a family history, you are not getting such a lifestyle of the patient to make a diabetes. And there is a history of, and if there is a history of intake of some steroids, we can definitely come to the conclusion that the patient is suffering from a drug disease. And last, in drug disease, homeopathy has got also a very limited action. We can also manage. Why drug diseases are incurable? In course of this drug disease, what happens inside the body? We know our vital organs are brain, heart, and kidney. These 5 vital organs, during the course of intake of these non-homeopathic medicines, in order to save the organism from a total destruction, vital force will sacrifice any 1 or 2 organs in the form of some pathological processes. So if these vital organs are not in order, we can't expect a permanent cure. That's why drug diseases are incurable. If such a patient comes, what you can do? If you are going to prescribe on the classical way, we will be in danger. We will not get results. So there, we have to go for those medicines which can antidote the effects of the previous one. We are blessed with our Materia Medica. There is more than 3,000 drugs in our Materia Medica. And a good number of medicines are there to get rid of these drug effects. If we examine the medicine Allosocatrine and Boric Materia Medica, the first line itself says, for the bad effects of prolonged intake of physiological overdosage of medicines. Medicines like Tucrium. Tucrium is also a good medicine for remove the bad effects of this prolonged intake. Naxomicia. Naxomicia is an ideal medicine for, not for allopathic drugs, it's for these vegetable preparations, that is Ayurvedic medicines or Unani medicines. Such vegetable pills, aromatic medicines, or pain effects can be antidoted with Naxomicia. Suppose a patient says she is in the habit of taking hormones regularly to postpone her periods, or for a PCOD and ovarian cystic diseases. If she is in the habit of taking hormones, she may need pulsatilla or platina. Cipri is also another medicine for bad effects of hormones. And suppose if a patient needs who is in the habit of taking these antibiotics, we will see in our daily practice, no? After taking antibiotics, their whole GI tract become damaged and they need the medicine Carbovich. So they will say, I can't take the simplest food. So that's the indication for Carbovegetables. So Carbovich, again there is sulfur is there, that also has got bad effects of antibiotic medicines. So if it is a drug disease, we have to also go for this physiological dosage. In homeopathy, we know we have got 3 types of dosages: physiological dose, therapeutic dose, and pathogenetic dose. Physiological dose, what we mean is lower dilutions. Actually, after the death of Hahnemann, what happens in homeopathy scenario is that our system has 3 pillars. Number 1, a principle. Number 2, our weapons, medicines. And number 3, dosage. The first 2 points regarding the principles and medicines, there is no argument. But regarding the third point, dosage, there is severe argument among the homeopaths prevailing at that time. The homeopaths grouped into 2. Some believes in high potency medicines, they are known as metaphysicals, and some believes in low potency, they are known as materialistic. So materialistic and metaphysical, the argument between these 2, the fight between these 2 groups damage the popularity of homeopathy during those days. So what are the physiological dose means? Crude forms. It can be used for palliation, for giving a temporary relief. So in drug diseases, we are forced to prescribe this palliative method. Medicines like, for such a case, which I mentioned earlier, we may need Syzygium, Gymnema, Abroma, or if it is a lady, female case with uterine complaints, we need this Helonias. In juvenile diabetes, we are using Crataegus. Uranium nitricum is also a very wonderful remedy for diabetes, especially if the gastric complaints are predominant. So such medicines we will use, and after, if the patient recovers from his pathological damage in the internal organs, we can try for a constitutional law. In second case, pseudochronic diseases, where it is otherwise known as false chronic diseases. Suppose the said patient, he came to you with a history of fasting sugar 280. You are inquiring into his history, family history. There is no drug induced, but his mode of living, his habits, his diet is enriched with those factors which provocates diabetes. And if you want him, how you can deal with such patients? So pseudochronic diseases are due to the mode of living of the errors in the diet and regimen of the patient. In such type of diseases, what we are generally doing is, we know the Porta Forza is likewise a preserver of health if he knows the things that derange health and cause disease and how to remove them from persons in health. So your advice regarding the stage of the disease, your warnings should be given properly to the patient, to those pseudochronic patients. You have to give some examples for those people who lived like way and now they are severely damaged. And such ways, your proper advice along with the medicine which can cover the complication of the said state, it can be given in pseudochronic disease. So we have discussed the physiological doses, and now we are coming to the therapeutic dose, which means curative dose. And another one is pathogenetic dose, which we are using for drug proving. That we can discuss later. So here, the first and last, third one, it is true natural chronic disease. What is true natural chronic disease? True natural chronic disease are always due to a myasm. Here, this is the most relevant theory of Hahnemann. Hahnemann come to the conclusion of myasms after his long observation of a good number of cases of his time, which he is shocked to see they are recurring. After the initial treatment, it disappears and the relapse occurs. He tries to find out the real cause of disease. And then he comes to the conclusion regarding the myasm. This 1 hour is not sufficient to explain all the matters. And this true natural chronic disease, how we can diagnose a true natural chronic disease? Even after the patient takes most efficient steps towards the disease, he keeps his diet, he keeps his lifestyle, he used to take regular exercise, proper timely food, sleep, etc. Everything is being taken by the patient, but his disease progress. So ever increasing diseases. Such diseases are known as true natural chronic diseases. And here, this true natural chronic diseases, Hahnemann, after looking into the history of that chronic disease, he finds that all the chronic diseases are passing through 2 stages. Number 1, a stage of functional disturbance, and number 2, a stage of structural changes. When he observes these structural changes, he again comes to the conclusion that some are proliferative in nature and some are destructive in nature. So all the functional disease he named as SORA, which means itch. All of you know the history of SORA. And the other group, proliferative type of diseases, he find out the history of suppressed gonorrhea and termed it as psychosis. And the destructive type, we find out the history of suppressed syphilis. So he named it as syphilitic myasm. So anything which is excess is due to psychosis, and anything which is deficient is due to sora, and anything which is destructive is due to syphilis. If we have a well knowledge regarding these miasms, it will help in our practice a lot. How? Let's see. Suppose a patient comes to you and asks whether this is curable or not, or how much time it will take. We heard that children are more affected with homeopathy medicines. Homeopathy medicines are not suitable for older people likewise. But these are all myths. No? A cure is always based upon the vitality or the constitution of the patient. It is decided by the genetics, the age of the patient, his history of any serious infectious diseases, previous vaccinations, the mode of living of the patient, his living environment, occupation, etc. These factors decides his vitality. Suppose if you are going through his family history, if the family history of chronic diseases, there is a brain diseases, cardiac complaints, respiratory complaints, psoriasis or psychic complaints. So an enriched family history shows the constitution or the vitality of the patient is weak and it will take a bit more time. See, if the family's history is enriched with such good number of disease, our medicine is Buforana. If there are a good number of a series of chronic diseases in the family, it's ideal to start with the Buforana. And there is any history of a strong infectious disease, there also the vitality become weak, and in order to arouse that vitality it will take a bit time. And if they are good, if there is no history of such so-called serious diseases in the family, there is no history of any severe infections, the patient is apparent in a good healthy constitution and his time for recovery is rather easier. There is a vaccination also. Why we are against vaccination? Because if the patient is underwent a series of vaccination, his vitality becomes weak. How? Why? When antisera is injected inside in the form of vaccination, what happens? When antisera is injected, bacteriolysis takes place in our body. The bacteria will be destructed. And you know, the bacteria has got two types of poisons, endotoxins and exotoxins. Exotoxins are those liberated during the lifetime of bacteria, when the bacteria is living. And endotoxins are liberated after the death of that bacteria. So as a result of injection of this antisera, bacteriolysis takes place. And as a result of this bacteriolysis, endotoxins will be liberated inside our system. And what is the role of endotoxins? In our junior classes, we have studied in pathology, endotoxins are responsible for degeneration of the internal organs. These endotoxins will degenerate the brain, heart, lungs, liver, kidney, and all organs. And what happens to the patient? In general, in due course, his vitality becomes weak and he develops a state of status infectious. That's why we are against vaccinations. His mode of living, it also decides his constitution, his environment and occupation. Nowadays, we can see a good number of patients suffers from undue stress as a part of their occupation, and this should be relieved. A good counseling, a good advice regarding the change in their life should be given by the physician. So treatment never consists of a single part. Treatment has got two parts, medicinal part as well as the auxiliary measures or the advices, the counseling of the patient. These are very important. The age also decides the constitution. So what we said in earlier, the soric, psychotic and syphilitic backgrounds, that should be evaluated. How we can get this miasmatic diagnosis? See, sorry, slide is mistaken. The miasms, the knowledge of miasms, and the real purpose of taking the case is to know the essence. Homeopathy treats the man in disease, not the disease itself, as all of us know. And homeopathy is a human science. It is not a laboratory science as the other systems claim so. Ours is a human science. And it is not our duty to prove homeopathy is scientific or not. Our only duty is to prove whether homeopathy is successful or not. Whether it is scientific or not, that it should be decided by some other peoples, scientists, etc. So here, the knowledge in miasm help us to get the clear picture of the stage of the patient. A miasm can be identified by its fundamental character and a group of symptoms. It can be diagnosed by its fundamental or latent character and manifestations. The latent character of SORA is that to produce functional disturbance. Patient says, I don't have appetite, I lost my sleep, I'm not thirsty, my thirst is decreased, I am suffering from constipation. So this type of functional disturbance that is due to soric miasm. And when we are coming to psychosis, proliferation is the key symptom of latent character of psychosis, and destruction is the key symptom of syphilitic miasm. As what we study in our Materia Medica, this has got the symptomatology also, the mental symptoms of psychosis and syphilis. When we are considering this patient picture, after taking the case, we have to group the symptoms into two sets. That is, primary symptoms and secondary symptoms. These primary symptoms, that means, primary symptom means those things which leads to the present stage of the disease. The presenting complaints are always known as secondary symptoms. And these presenting complaints are always the end product of a prolonged process. And that process should be considered. We have to focus upon that process, not for the secondary symptoms. They are the end results. So, after taking the case, we come to a good portrait of the patient. We are making a totality. And that totality should be the only guideline for the selection of a homeopathic medicine. When we are selecting these medicines, we have to consider all three aspects of this totality. Generic totality, individual totality, and the specific totality. The medicine should cover these three phases. The medicine should cover the organ, it should cover the key symptoms of the patient as a whole and should cover the specific condition of the patient. So based upon these factors, we are selecting a medicine which is most similar to that of the portrait of the patient. Here, we have to consider the myasm also. If the patient is suffering from a psoric picture, we have to prescribe a psoric medicine. If he is suffering from a psychotic nature, if he is suffering from a syphilitic nature, the prescription should be likewise. If we examine the child remedies, you can see we are prescribing commonly cinna, belladonna, sulfur, chamomilla, aconite. All these are psoric in nature. When we are coming to a younger age or a middle age, you can see our prescription changes into natramure, lycosis, lycopodium, sepia, pulsatilla, natron sulf, etc. Then they are psychosis. And in the later part of the life, in old age, you see your prescriptions, majority of them are filled with anti-syphilitic medicines like fluoric acid, Organon, nitric acid. So, these phenomena of this pathology, the person who is psoric in his beginning gets into a psychotic stage and later onwards he becomes syphilitic and death occurs. If a child, you can understand the myasm from the very birth onwards. Suppose if a child is born with the icterus neonatora, physiological jaundice, predominantly the child will be a psoric in nature. If he is born with this asphyxia neonatora, it will be psychotic in nature. And if it is ophthalmia neonatora, it will be generally syphilitic in nature. So this knowledge in myasm, it will help you to understand the pathology. It will help you to get rid of to get a clear diagnosis, the stage, and the prognosis of the disease also. Suppose two patient comes and asks, Doctor, we are having severe toothache. Do I want to extract this teeth? One patient says he is suffering from a daytime aggravation and he can sleep apparently good during night hours. The other one says he is having severe pain in the night and he can apparently go for his job during daytime. So both of them ask whether they want to extract this teeth. How you will give answer? The first one, who can tolerate the pain during night and suffer severely during daytime, it's a manifestation of psoric myasm, and in there you are in a position to identify the pathology, and you can say there is no need to extract because there is only a functional disturbance. There is no pathology. And in the second case, which is worse at night, you have to advise to extract because it is syphilitic in nature. Syphilitic myasm has got a night aggravation and there is destruction already started. So, a disease, it has got this functional disturbance and structural changes. These structural changes are of two types, reversible and irreversible. So, the field of similia, in the aspect of cure, it lies on reversible structural changes. We can also palliate the irreversible pathologies. There we are also managers. We are managing the cases. In reversible pathology and disease with the fully functional symptoms alone are completely curable as per our principle, as per our system. So a person who is in apparently healthy state, all of us know health is maintained in the body for our life, is governed by that principle, vital principle, dynamics. The vital principle is there inside in the form of a dynamic plane. Similarly, the myasms are also in a
dynamic in nature. We can't see it, but we can feel it. So the constant battle between these two dynamic forces, vital principle and myosomes. When the myosomes gets upper hand, patient becomes diseased. When the vital force is in upper hand, patient is in apparently healthy state. So here, this the factors which are mentioned earlier, the genetics, his lifestyle, his mode of living, vaccinations, past history, etc., which will provocate the myosome, which are generally in a position of latency inside the body. And when these tendencies provocates these myosomes, they will arouse and develops their peculiar nature, that is diseases. So, we know the symptoms of psoric myosomes, psychosis, and syphilis. I am not going into the depth of such explanation. These are the manifestations. A psoric personality who is intelligent with full of ideas, but it can't be useful for him since he is perverted. He's having an open mind and extroverted with his physical appearance, that bright eyes, fear, anxiety, and irritability. That anger is there for psoric patients, and they are never satisfied. They are very sensitive, and the functional disturbance are due to psoric myosome. When we are coming to the psychosis, the most important characteristics of psychotic myosomes, they are doubtful, they are cunning, they have a closed mouth personality. They will not reveal their secrets. They are always secretive, and that's why they are suspicious. The things the other people also hidden some facts from him, because he is already a concealed or a closed mouth personality. That's why psychos become suspicious. They hide things, and they are born with a criminal tendency. And they are very selfish. They love themselves. Absent-minded, busy always, and at times they are very cheerful. So this psychotic personality needs an antipsychotic medicines. Syphilis, the third myosome, is dull in expression. They are hyperenergic in the earlier stages. They are very active and destructive in nature. These children's with syphilitic personality, ADHD like that, such diseases are syphilitic, basically syphilitic myosomes, belongs to syphilitic myosomes, and they explore their anger and having great depression in their life. They are very sluggish, and suicidal impulses are there. Their mind is being prostrated, and they always in a dull mood. We can see in our Materia Medica, our drugs, generally our polycrest medicines covers all these three myosomes. One will take upper hand. Based upon that upper hand, we are categorizing our medicines into antipsoric, antipsychotic, and antisyphilitic medicines. Here, after taking this case, we are constructing the totality, and based upon that totality, we are selecting a medicine which is most suitable. And along with this medicine, we are selecting the potency also. Actually, in homeopathy, there is no potencies like high, medium, or low in practical aspect. In practically, we are selecting a potency based upon the clarity of symptoms, the clarity in expression. If the patient explains his symptoms in very clear form, generally such patient needs high potency. If the patient is very sluggish, they can't express their symptoms in apt form, They generally require medium or low potency. It's a practical aspect. And here, the potency, all of you know. We have got centesimal, decimal, and 50 millisievert potency. Generally, in our daily practice, majority of us uses that centesimal scale. And when constructing the totality or when selecting the medicine, you have to give importance to the mechanisms, the thermal reaction, and the side affinity. It will help you to come to a particular group. Suppose if your patient is psychotic, if your patient is thermally hot, if your patient is having more affections on left side, you can categorize that patient into psychotic or left-sided personality. When you are looking into Materia Medica, then it becomes that broad Materia Medica, it becomes very strong. Come to a conclusion. Either it is Natramiol or it is Psychosis. Both these medicines are psychotic predominantly. They are hot in nature and they are having a left-sided affinity too. So here, Natramiol is a closed personality while Psychosis is having that verbal diarrhea, very loquacious. So based upon this trick, you can select the chronic medicines very easily. So in selecting the medicine, you have to give more importance to the potency and generally you have to prescribe your medicines in minimum doses. Hahnemann never advised single dose. This is also a myth commonly we can find in our homeopathic practice. Majority of our seniors says Hahnemann always said single dose, single dose. He never advised single dose. He only advised minimum dose. Single dose at a time. After the action of that dose is over, if you want to repeat, you have to repeat the medicine. So here, medicine also, single remedy means single remedy at a time. He never advised to prescribe a single medicine for a patient during whole his lifetime. If you are going to the aphorism number 171, you can see in non-venereal psoriatic chronic disease, you may need several antipsorics in succession. Each successive one should be in consonance with the group of symptoms remaining thereafter. So, when we begin our practice as neo-homeopaths, you got only a partial picture in majority of cases. In majority of cases, the patient, due to failure from the part of the patient or due to failure from the part of the physician, maybe the casing may not be properly done. You have to force to prescribe partially similar medicine. So in such conditions, what we have to do, the treatment is always going accordingly. The status morbi is the basis of a prescription. Status morbi means the presence of the disease. Here, after selecting the medicine with exact potency and dose, you have to give proper guideline for the time. The time of application is also very important in homeopathy. Suppose if you are selecting Naxomica and says it should be taken in the morning, it should make worse. And if you are selecting sulfur and you are advising the patient to take in the night, it's also do harm. So, a medicine should be prescribed based upon its modality. You should never prescribe Pulsarla in the evening. Or when giving advice, suppose your patient who is suffering from bronchitis, if she asks, doctor, can I go for a daily bath? If he says, no, you should never take bath for 1 week, she will get mad because phosphorus must bath several times per day to get a relief. So, when you are giving advice regarding the diet and regimen, you have to look for the modality and the etiology of the medicine you prescribe. The time of application should be in tone with the modality. Generally, psoric medicine should be prescribed during night hours, except the sulfur. We know the sulfur is the king of psoric medicines. Similarly, psychosis is the king of Tuja is the king of psychotic medicines, and Mercurius is the king of syphilitic medicines. So this psoric medicine we can prescribe generally at night, when syphilitic medicine should be prescribed in the early hours of the day. And psychotic medicine also prescribed in the morning hours. So there is some difference in this aspect. It will make your practice more successful. And during the second visit, after the initial prescription, during the second visit, what happens? You have to look whether your medicine is acted or not. So only these two change. What happens there? Either there will be a change or there is no change. Patient says, "Doctor, there is no change. Last 3 weeks back, I came and you have given me some medicines, but there is no change in my present situation." There the possibility is, sometimes your medicine may be totally wrong. Totally wrong. Or the medicine may be correct, but the dose and potency is too insufficient. You have prescribed Naxomica, you have prescribed 30, but suppose the patient needs a 10 potency. Depends upon his susceptibility. Naxomica 30 will not act. It will act, but the action we can't percept. So, number one possibility is medicine may be entirely wrong. Number two, dose and potency is too insufficient to make a perceptible action. Third one, there is a chance for some antidotal tactics. If they are taking the medicine, the patient may undergo some those factors which can antidote the action of Naxomica. If you take something like that, there is also a chance for not to act the indicated medicine. Or there may be chance of presence of fixed myasm. What is fixed myasm? Which occurs only once in our lifetime. During the process of case taking, we have to look for these fixed myasms, and without removing the stain or stigma of that fixed myasm, your indicated medicine will not work. Here, you have to go for intercurrent remedies. So, if it is acts, whether it is in a positive or negative way, you can observe the proper thing, what happens in the patient, where your medicine is acting in a positive way. Definitely there will be changes in the generals of the patient. His appetite, stool, urine, sleep, etc. will be better, though his presenting complaint is still there. So you should never worry about the presenting complaint. During your second visit, you have to inquire about the generals. That's why we say that homeopathy is a human science. And if our indicated medicine is not acting, we have to look for the presence of fixed myasm. And suppose if the patient is having severe mumps in the childhood, your present indicated medicine is not acting, you have to go for pulsatilla or pyrrotidinum. If the case is having a history of chickenpox, you have to go for Tuja or variolinum. If there is a whooping cough, you have to go for Drosera or pertussin, like that. Then only your indicated medicine will work more. And when we are considering the medicines, we have to study the materia medica in regards with the knowing the essence of each drug. See, Naxomica. What is the essence or what is the keynote symptom of Naxomica? It's a conqueror. Conqueror. They are hurried, alcoholic and workaholic, who are hurried and worried till they buried. If you go for sepia, the constitution, it's an acquired constitution from repeated pregnancies and sexual excess. Repeated pregnancies and sexual excess makes the constitution likewise. And sepia is a independent woman. So you have to make a key symptom in your constitutional medicines. Lycosis, the key symptom is sexual tension. Lycopodium, impotent. Tuja, sexual guilt. While if you are going to natremure, emotional pain. When you are looking for the symptomatology of natremure, in both you can see psychic cause of illness. Ignatia, an emotional roller coaster. Arsenical, physical insecurity. Likewise, you can go to you can develop your materia medica, or you can enrich your materia medica. So, when we are discussing this intercurrent remedies, generally no salts are used as intercurrent remedies. The use always comes when our indicated medicine is not active. In order to act a medicine properly, we need the patient's reaction in a proper way. The reaction may of 3 times. It can be increased, decreased, or diminished. So increased and decreased patients. Increased patients are known as these idiosyncratic patients. Even a single minimum dose will increase their reaction. Decreased, your indicated medicine will not act. And in order to modify those reactions to a normal form, you are using intercurrent remedies, that is no salts. And reaction may be destroyed in cases of drug diseases. That is why you are not getting a cure in drug diseases. There are various types of prescriptions out there. Classical prescription, where we goes after casting, we are going to repertory. If the case is enriched with the physical and mental symptoms, a good number of symptoms are there. This method is always good. And applied materia medica. It depends upon the knowledge of your knowledge in materia medica. After taking the entire case, if you are struck with the medicine, you can clearly indicate that medicine. That's applied materia medica. Therapeutic method, which we are using in acute diseases, for pneumonia, for typhoid, for jaundice, for nephrolithiasis. Likewise, there is a group of medicines out there that they are useful in acute diseases. Some prescriptions are based upon etiology. Suppose a patient who is having backache after a trauma to the back, they are selecting 20 MAC. 20 MAC has got injury, trauma to the back and leads to a good number of series of diseases. Etiology. It's also very good type of prescription if you are getting it properly. If there is a mental as well as physical trauma, arnica comes, we know the etiology of various drugs. Suppression, prescription based upon suppression. See, Syngum metallicum, suppressed eruption leads to nervous disorders. So, there is your case is enrolled or encircled regarding a suppression, you have to break that. So, skin disease, when it is suppressed, it leads to asthma, hepar arsenicum, sorinum, or sulfur. So, if you get a clear picture regarding that suppression, you can go for it. No salts. Generally, we should never start the treatment of a chronic disease with no salts. Intercurrent remedies, it will favor the action of your indicated medicine. In pathologically advanced cases, we are going for organ remedies. Very short time is there. I just mentioned about some medicines about lungs, aspidosperma, senega, grandalia, lobelia, arelia, eucalyptus, balsamum peru, etc. There are a good number of medicines and the indications are different. For cardiac complaints, we are blessed with Crataegus. It has the power to dissolve the scars in the vessels. Crataegus, cactus, strophanthus is there, Loroceras, and arsenica adam is one of the best medicine for majority of the cardiac complaints. And in old age, we have to go for Beratral. It's a cardiac tonic. So So there are a good number of organ remedies for heart also. When we are coming to kidney, berberis, hydrangea, Pareria breva, solidago. Solidago is known as homeopathic catheter. Zingiber. Almost during the last stage of kidney diseases, the proper application of zingiber will give good results. So there are a number of medicines for kidney also, in liver, Ceridonium, Berberis vulgaris, Cardus marianus, Myrica, Leptandra is there, Chionans is there. So we have got all weapons in our hand in brain diseases. This Avena sativa, ginseng is there, very good medicine. Tinospora is there, alfalfa is there, brahmi is there. So these are known as organ remedies. And some prescriptions were based upon laboratory findings. Suppose a patient suffering from allergic and his Ig level is more than 3000. Ig level is severely increased. The number of medicine is sulfur. So based upon some lab report only, some investigations, the patient may have not any symptoms. When he underwent a scan, he find a calculi in the left renal pelvis. So you are not getting any symptoms. Patient is having no pain or no difficulty in urination likewise. That's an accidental finding. You are prescribing berberis. So such things can be done by this lab investigations. And placebo prescription, it is very important. In a majority of the situations we are depending upon these placebos. We know the indications of placebo. And as per Stuart Claus, if you don't know what to do, you do nothing until you comes to know something to do. Prescribe placebo. So patient needs something emergently. And then you are in confusion. Which medicine has to be given? Something must be done at that time. Something must be done. Immediately you have to prescribe placebo. And this, there are 4 medicines which you have to keep in your table, like Belladonna, Aconite, Coffea, and Ferrophos. These 4 medicines are known as the sudden and violent medicines, heroic medicines in homeopathic practice. So, we have discussed earlier regarding the diet and regimen. Let's go through the slides. So here, I think our time is over. And if you have any doubts, you can please ask me. Sir, can I stop the presentation? Sir, can you hear me?
Okay, sir. Thank you, sir.
Man has told me to stop by 2 o'clock. That's what
Sir. Okay, sir. Is there anything remaining, sir? You can continue with 5 minutes, sir.
Okay.
Okay.
So, so can you see me?
No, sir. Yeah, sir. Aurum metallicum. Yes, sir.
So, as my advice to neo-homeopaths is that you must have a strong belief in our system. You can gain whatever you wish to be in your life with this homeopathy. Stuart Claus finally says, homeopathy is in a nutshell. It's a shell which some finds hard to crack, but when cracked, it seems to be packed with full of sweet and wholesome meat with no worms in it. Your decision at the present time, which has to be prescribed, how it should be followed. You have to go for the opinion of the seniors. You can refer books. Nowadays, there are a good number of social medias are there. A good number of webinars are going on. A very eminent team of teachers are there. And moreover, homeopathy is the most, India is the most popular nation for the spread and development of homeopathy. You have to make use of these chances. And I always advise you to stick on to homeopathic medicines alone. Whatever you can do with homeopathy. If it's in a curative line or if it is in a palliative line, you have got a good number of medicines. So, try to become a genuine homeopath. Don't become mongrel sects, as Hanuman says. It will give you everything you wish. And homeopathy should be a passion. Our profession, it should be a passion for us. Then only we can get success in our daily practice. You should refer Materia Medica. You should be always in touch with Materia Medica. The knowledge in your Organon and other allied subjects should be correlated. And the present status of the disease should be, the exact pathology should be evaluated properly, and the steps should be taken based upon that. So, these are some medicines for cardiac complaints. I have prepared a good number of slides when the time permits. And when we get more time, we can definitely share all this. And now I stop my presentation. Once again, I give a big thanks to all of you who hear me patiently for the last 1 hour. Thank you, sir.
Thank you, sir. Thank you, sir.
Yeah.
Good afternoon to one and all present in this webinar. Sir has started in the aspect of the knowledge of application of Organon in terms of Materia Medica. Sir started the journey of homeopathy with master, the sketch of the master, that is Dr. Hahnemann, in field of Organon, how discovery of homeopathy takes place. Then sir started, as soon as patient enters in your clinic, your observation must start. It is the responsibility of each and every clinician. It is the responsibility of each and every consultant who are attached with the homeopathy. So we have to judge, and according to homeopathy concept, whether patient is having acute disease or chronic disease. If patient is suffering from acute disease, then we have to find out the exciting cause. If patient is having chronic disease, then evaluation of the disease, which is very important. Regarding the, sir is given the examples of the teucrium, then the evaluation of the disease, then miasmatic theory, intercurrent treatment, importance of the dosage. Then we have to follow in order to prescribe the homeopathic remedy, we have to follow the principles of homeopathy. That is the first thing. Second is weapons, that is medicine. Third is dosage, that is drugs. So, and simultaneously the role of the diet and regime, which is very important in order to cure the patient. So cures, which is based on the constitutional theory of constitution, how we are against the vaccination. Sir nicely explained the role of the pathology, that is the endotoxin, exotoxin. Endotoxin means liberate inside, which resulting into degeneration of the internal organs. So nicely integrated the knowledge of the pathology with the, in terms of the organon. Then sir started the theory of the miasm, then attributes of the sora, psychosis and syphilis, responsible miasm in order to treat the chronic disease. Sora, that is fundamental changes or any functional changes which pertaining to sora. Psychosis, nicely explained with clinical utility with one case, that is sora functional changes. syphilitic aggravation by night, and functional changes with the scope of homeopathy, soric or functional changes within the scope of homeopathy, syphilitic trait, destructive tendency established, we can palliate the condition. So dynamic force with the contest with the miasm and vital force. So when tendency provocates, it's resulting into disease. And sir has nicely explained the knowledge of the organon. We have to strictly follow the rules and regulation which has been designed in terms of the organon. That is miasm, selection of potency, psychotic miasm with differentiated with natramure and lachesis. So we have to, medicine should be prescribed on the basis of the modality also. So time of administration, which is a very important. So sir, you have nicely integrated the knowledge of the organon with Materia Medica. In terms of Materia Medica, different types of prescription, classical, applied Materia Medica, then therapeutic, etiological, suppression, and no sort. So on behalf of Faculty of Homeopathy, Parul University, I will start with my assigned vote of thanks. Parul University, I take this opportunity to propose my vote of thanks who have directly and indirectly contributed to this webinar. At the onset and at the outset of these particular things, I highly thanks to eminent speaker and resource person of today's webinar, respected Dr. Prakash sir, for spending your valuable time with us. So, sir, we are really enlightened with your knowledge and presence. Thank you very much, sir.
Thank you,
We are
sir.
thankful to Honorable President of Parul University, Dr. Devanshu Patel, sir, and respected Dr. Komal Patel, madam, Director of Ayush Colleges of Parul University, for keeps on motivating us and inspiring us. A special thanks to organizing committee, Dr. Purav Desai, sir, Dean of Faculty of Homeopathy, Dr. Hina Raval, madam, Principal of Ahmedabad Homeopathic Medical College, Dr. B.P. Pandya, sir, Principal of Parul Institute of Homeopathy and Research. Special thanks to our team of the technical events, that is Brijesh sir and Jiten sir, for nicely coordinating the speakers. For their unflinching support and coordination, our heartfelt thanks to all the delegates for your active participation. So stay connected. Thank you, all of you. We move to the end of today's webinar. Thank you, sir. Thank you. Thank you very much, sir.
Thank you, sir. Thank you.
Thank you. Thank you. Thank you. Thank you.